This is the case of detransposition of gate arteries. In this image, what you see, this is left atrium, this is right atrium, and this is patent promenobile. Flow is bidirectional, though mainly left to right. This, you see the flow. This red flow indicating flow left atrium to right atrium. Blue flow means this left to right, and blue flow means right to left. So very less right to left flow, mainly left right flow. I am analyzing frame by frame. You see this is slightly blue here, this is blue, this is blue. So this is case of detransposition of gate arteries. This is the detransposition of gate arteries. I want to show detransposition. So in this image, this is aorta. AO means aorta. This is pulmonary artery. You can see flow turbulence in pulmonary artery indicating some sort of pulmonary stenosis. If turbulence has started almost from the valve level, then that will be valvular stenosis. If it is happening below the valve, then that will be subvalvular also. But in this case, what you see in the image, the turbulence of flow starts from the valve. So likely finding is significant valvular stenosis. This is right ventricle. From right ventricle, pulmonary artery, from right ventricle aorta is coming. From left ventricle, pulmonary artery is coming. This is left atrium. Now you understand by image, this is left atrium, left ventricle. From left ventricle, pulmonary artery is coming. Here the flow is reversed. What you reverse means, pulmonary artery is coming from left ventricle instead of right ventricle, from wrong chamber, you say. That is called ventriculo-arterial discordance. So ventriculo-arterial discordance, left ventricle to pulmonary artery, right ventricle to aorta. There is no flow obstruction in aorta. At the same time, aorta and pulmonary artery both are parallel. You can see whenever you see parallel arrangement indicating transposition, whether detransposition or L transposition, that must be transposition. You can see that how the blood is coming into aorta, how the blood is coming into pulmonary artery. Both are in longitudinal. You can see the maximum part of the aorta, maximum part of pulmonary artery in the same plane, in the same view, indicating transposition. As there is no AV discordance, that is AV concordance. AV concordance means from right atrium into right ventricle, from left atrium into left ventricle. So concordance at the level of atrioventricular junction, discordance at the level of ventriculo-arterial junction. That is detransposition of gate arteries. Again the same thing, you can see this is significant pulmonary valvular obstruction. This is VSD. This is a pulmonary VSD having bidirectional flow. Just try to memorize the circulation. All systemic venous flow coming into right atrium, then right ventricle, then aorta, then again right atrium, aorta, through aorta, all the whole body, from whole body, right atrium, through vena cava. So what happens, right sided blood from whole body, again right side, whole body, right side. So blood circulation is whole venous system, blood comes into right atrium, right ventricle, then aorta, again through aorta, all the whole body receives the blood from aorta and then comes to right atrium. So left atrium This is left atrium, this is left ventricle. So blood comes from lungs into left atrium, then again left ventricle, from left ventricle into pulmonary artery, from pulmonary artery again pulmonary vein, and then left atrium. So lungs and left side is together. So ultimately whole body with right side and lungs is with the left side. That in case of detransplant there must be some communication, mixing of blood, so that the child will survive. In this case mixing is because of this VSD, that is subpulmonary VSD, large VSD, and very small PFO, pattern foramen. The flow is left to right in that case mainly. So that is the how circulation is interpreted. There must be some sort of ASD, VSD or PDA for mixing, otherwise the child will not survive. So whenever child is surviving, there must be some sort of this thing. You must try to find out whether ASD, VSD or PDA is present in this case. In this case only VSD is significantly present, no PDA. PFO is very small. Now you can see the flow turbulence. This is pulmonary valve and there is flow turbulence here. This is left atrium, this is left ventricle. You see, this is left atrium, this is left ventricle, this is flow turbulence. The cursor is at the flow turbulence at the level of valve. So severe valvular stenosis. This is now this is right atrium, this is right ventricle. Now you can see right atrium. This is right atrium, this is right ventricle, this is left atrium, this is left ventricle, this is pulmonary artery is coming from left ventricle. The subpulmonary VSD is there. Flow is mainly, though the flow is bidirectional, but mainly seems from right to left, mainly blue, slightly red. And that is compensated by PFO. PFO is mainly left to right. From left atrium to right atrium, VSD is mainly right to left, but there is bidirectional VSD. Flow is bidirectional. Left ventricle chamber is D-shaped, indicating raised right ventricle systolic pressure. D-shaped left ventricle. In the same image you can see this is right ventricle and aorta, this is left ventricle and pulmonary artery. This is VSD. This is pulmonary artery, this is aorta. Aorta is superior in comparison to pulmonary artery, because probe is placed at the anteriorly on the anterior, obviously anterior part of chest. So this is most anterior part of the image, and this is right ventricle, and for right ventricle aorta is comes. So aorta is anterior compared to pulmonary artery. You can see again the pulmonary valve is not opening fully and slightly thickened compared to aortic valve. Flow turbulence you can see in this pulmonary valve. This is flow turbulence. You see here the flow turbulence. Most likely the pulmonary valve is having bicuspid valve because flow is quite eccentric. You see the flow is going through here. This is the portion through which the blood from left ventricle is going into pulmonary artery. Most likely bicuspid. Have not confirmed. This is aortic blood flow from right ventricle. Now you can see pulmonary blood flow has turbulence. In this view you can see this is pulmonary flow and this is aortic flow. This is aortic flow and this is pulmonary flow. This is pulmonary flow and this location will have aortic flow, and this is aortic flow. This is aortic flow and this is pulmonary flow. This is pulmonary valve location. This is aortic valve location. So aortic valve, aorta is anterior and right of pulmonary artery. In this image you can see this right of pulmonary artery. This is right atrium and right ventricle, and you see the right side. So aorta is right and anterior to pulmonary artery. Now you can see again the same thing. Pulmonary artery is coming from left ventricle and aorta is coming from right ventricle. Now you can see the same. This is, just want to nomenclature it. This is left atrium, this is left ventricle, and this is pulmonary artery. A significant pulmonary valvular stenosis here. And this is right ventricle, and this is aorta. So case of detransposition with severe valvular pulmonary stenosis with PFO and large subpulmonary VSD. Right sided pressure is quite high because LV chamber is D-shaped. That is the finding. One thing I have always said, if you have confusion whether this is pulmonary artery or aorta, what you see in this case, as pulmonary artery comes from left ventricle, it goes posteriorly, because this image, this is the most anterior part, this is most posterior part. So as pulmonary artery arises from left ventricle, it goes posteriorly. Aorta, if it had been aorta, then it would go anteriorly, not posteriorly. So whenever you find the artery that is coming from left ventricle as going posteriorly in the beginning, that means it is pulmonary artery, not the aorta. Though you can see both aorta and pulmonary artery in the same plane in long form, longitudinal section indicating parallel arrangement, indicating transposition of great arteries. In this case, detransposition of great arteries. Thank you.